Madam President. I rise in opposition to this appointment as well. And my concern has to do with the department who, when the reorg occurred, was identified as the administrative home to Early Childhood Iowa. That program is a program that is shared between Department of Ed, Economic Development, Workforce Development, and Health and Human Services. But we have seen two bills come before us with the department's support that tries to fit a square peg in a round hole in regard to moving everything that this council commission has been doing to fit into the mold of HHS, which was absolutely not the intent. And there has been a number of board meetings of the Early Childhood Iowa Board where HHS staff are trying very hard to convince them that this has to be done, that moving into the framework of HHS is the only way, when for 2 decades it has not been that way. An administrative home does not mean being enveloped into one department only. There has been feedback from the 34 Early Childhood Iowa area boards that have shared all of the work that they have done in birth through 5. The most current bill does not, although it keeps the board intact, it does not reference birth through 5 once. It is birth through 18. There are specific programs and needs of early childhood children. And the value of the early childhood program is to work with children and families and provide services within their own community, services provided by people that they know and trust and respect. And when there might be an issue that HHS could be the next step, then recommend that. But it is a program that prevents individual families or children from moving into the HHS system. And they have done it well. But HHS doesn't seem to understand that. And they again continue to absorb everything and force everything into that mold. Not only the mold of HHS, but eliminating local boards, 34 of them, and putting them into the 7 behavioral health districts. And thinking that personal community engagement doesn't matter. It certainly is a misunderstanding, but it is a failure to provide services to birth through 5 children, and a lack of respect of all of the work that has been done and will continue to be done in the Early Childhood Iowa area boards, the 34 that are in your community working with your constituents.